Good evening, everyone. My name is Harish Mohan, and I will be talking on the topic today, which is smart hospital for the future. And let me start by telling you something about myself. I am currently working at Apollo Hospitals, Lucknow, as a head biomedical engineering, supply chain, and hospital projects. So I am basically into designing of hospitals, um, purchasing the equipments, and then running it afterwards. So it's been a pleasure with working with Apollo Medics Super Specialty Hospital, Lucknow, as I have been working here since last 10 years, and I've been I have myself designed this hospital. I have myself procured all the equipments, and now currently I am heading the supply chain, and I'm running the show here. So moving forward, let's just brief you about the hospital. Lucknow, being the state capital of the largest state of India, which is population-wise, before Apollo Medics Super Specialty Hospital, we did not have any corporate hospital in the city of Lucknow. So Lucknow was the last state capital in India to receive any corporate healthcare delivery systems. So Apollo Medics was the first hospital which was launched in Lucknow, and following suit, there are now currently 2 to 3 corporate hospitals in Lucknow, and we were the pioneers of starting the corporate setup in the state of Uttar Pradesh. So it's a 330 beds hospital. It's a quaternary care multi-speciality facility with latest medical technologies, and it is a destination for patients which used to move to metros, Delhi, Mumbai, to get their treatments done, since there was no super specialty hospital available in previously. We currently have a gamut of services that we provide here at Lucknow, and which includes complete oncology setup, including radiotherapy and nuclear medicine setups, and top-notch in critical care services, which includes ICUs and ICUs. And we currently have started our kidney transplant and liver transplant programs also, and we are working towards launching the state's first heart and lung transplant setups also. Coming back to the topic that we will be discussing today is smart hospitals. So let me I'd like to break this word into 2 parts. Hospitals, we all know, we have been in the fraternity. All the listeners today will be associated with some or the other hospital setup, working from more than 20 years to working from last 5 months or 6 months or so. So we've been connected to a hospital. We'll start. We'll talk on the concept of a smart hospital today. So when we hear the word smart, what comes to our mind? Somebody asks you a question, and you give a prompt, correct, and precise answer to that question. Your image is taken as a smart person. So being smart is just giving the right data at the right time, without any errors, and a smooth transition from data from one place to another. When the smart word is added to a hospital, the data that we talk about is the information about the patient, which is transmitted from one place to another place, and the end user for that data usually is a clinical expert, or a physician, or a doctor, or a surgeon, which uses that data to take calls on the patient, and so that the treatment line of the patient is decided, so that the patient has a seamless experience in the hospital and gets treated well. Smart hospitals we've been working in the healthcare setups from last many years, but those who've been there from the last 10 to 15 years, those who are here, those who are listening to this webinar today, might uh, confine with me in understanding that initially hospitals had everything in a manual process. So everything was written on paper, everything was transferred from one place to another by a ward boy or a GDA or any manual form. So the information that used to travel from one place to another in a hospital used to be manual that those days, which incurred a lot of time, and and there were many manual errors that used to happen, which in turn affected the treatment of the patient. So in order to become a smart hospital, there are certain objectives for the for one to follow. So, and it boils down to the management of data for the patient so that the doctor can take the right call at the right time. These include remote medical care. You need not be stationed with the patient. You need not be there physically with the patient. The doctor can take a call wherever he is. So remote medical care, enhanced patient safety. If the data is precise, if the data is to the point, the patient safety will not be compromised. Seamless patient flow. There are places wherein movement of patient is a very frequent activity. For example, the emergency, when one patient comes, one patient gets the treatment, it is transferred back to his home, or taken back into the operation theater or ICU or wards. So if the patient flow is seamless, the patient gets the right treatment and right time. Then cyber resilience, for the data to be transmitted smoothly from one point to another point, you need to have a carrier in between, which is currently the internet. So the internet is currently the medium through which the data transfers from one place to another. So if that network, if that internet is resilient enough to transfer the data at the right time, does not hang up, does not break down, has minimum breakdowns, then a smart hospital functions as a smart hospital. Then improved diagnostic and surgical ability and trustworthiness of the staff who's punching in the data, who's transferring the things, is also plays the major factors in making a hospital a smart hospital. So then it all converges into single point of thing, that is data. So everything that happens in a smart hospital is responsibility of the data which is flowing from one place to another place. Data is considered an important asset from an information security perspective. Many decisions a smart device will take based on the data of for the analysis of the collected data. Clinical, administrative, financial, all these research data, all these are mainly contributing to making a setup, a hospital or an organization a smart organization, which is because how this data is being used to take calls, to take decisions, and to take decisions for the patient. Now we come down to smart ICUs, because ICUs plays a major role in treatment in a hospital, where the critical patients are there, which needs continuous monitoring from the staff and from the doctor itself, so that if their parameters are off by a single percentage also, the doctor knows and he can tweak the treatment of the patient accordingly at that right moment of time without any delays. Then that is the main reason ICUs play a very important part in the hospital, wherein critical patients are treated, and just because it's a split-second decision for the doctor to the patient may survive or may die. So if we have smart ICUs and seamless flow of data in the ICU, It will be beneficial for the clinicians, the ICU doctors, to take random calls supported by logical data, which can be very pivotal in saving the life of a patient. Then then comes the question, the same question which we answered in the start of the presentation about smart hospitals. The same question comes, where what is smart ICU, then benefits of ICUs, smart ICUs, requirements of the smart ICU, and then technologies which we are using currently or we may use in future in the ICU to make them smarter. So smart ICU is the same concept as the smart hospital, seamless flow of data from one place to another. In this case, specifically to the ICU doctor and the ICU nurse who is treating the patient, so that the treatment chart can be modified accordingly. The concept of ICU, smart ICU requires patient being the center of all these interconnections. So every data that is being originated and traveling in the ICU is concerned about that single patient that's there on the bed. Then these interconnections, these data traveling throughout the ICU goes to the ICU doctor, which takes the call for the patient. So the smart ICU must have the ability to interconnect all data and monitoring systems within the same software with language interpretations and analytics, which will support the clinicians to take the call. Imagine a doctor sitting in an ICU all day long for an 8-hour shift and seamlessly looking at numbers, seamlessly looking at data, which causes a mental fatigue also, which hampers the ability to take calls. So it is not enough that we feed the doctor with seamless numbers and data also. We need to feed them with analytics and interpretations of that data also, which is being done by the softwares and the servers that we are using to transmit data. So that it makes the clinician more aware of what this data means, and he is able to take that call with the support of the system, of the software that is helping him to take a call for the patient. This data can be historically stored also, and so that any doctor who's coming on the next shift can analyze the previous shifts or previous days data, which will help them to take a call accordingly. The system can also be accessed by the clinicians remotely, so which means that we do not have to, the doctor does not have to be physically present in the ICU, which gives birth to a new concept, that is the Tele-ICU, wherein the doctors need not stay at that hospital. They can stay at some place else, and just at the command center of the remote hospital, the doctor can see the vitals of the patients. They can access all the information of the patient. They can see the patient through a web call or a webcam access, and can take calls for the patient. Benefits of smart ICUs: it is all evidence-based practice. So what is evidence-based practice? All the data that comes to you, that comes to the doctor, is all taken from the equipment, the medical devices, or the sensors placed on the patient. So that is the single point of evolution from the patient to the doctor. That data is not being tampered with in the medium. It is being represented as purely as it was taken from the patient. It is only added with interpretations and analytics, so that the doctor takes a informed call from the patient. The benefits, there are many benefits, which is that it promotes evidence-based practice, which we already discussed. Enhanced monitoring, early identification and treatment of critical illness. The early the doctor gets to know the data, the early he can take a call and save a precious life. Improved coordination of care, facilitate the management and care of patient, and improve patient outcomes. So if a patient is treated at the right time before anything goes worse, there are more chances of that patient to become healthy and get discharged from the hospital and lead a normal life again. Requirements of a smart ICU. There are basically, see, we've been talking about data traveling from one place to another. So the requirements to get a ICU smart or a hospital very smart. So the main is the connectivity that we should develop in the hospital. So that it should be seamless. The data should not be um, slow, or should not be lagging in anything. There are three major elements for the delivery of care. Smart ICU to work in order to make a smart ICU work. The first thing is to elimination of harm. The second is engaging all critical care professionals, patients, and families. The third is the increasing proficiency and personalized care through use of technology. The third point is more related to the data traveling, which we are discussing currently. First and second points are more of a clinical side, which translates into the quality of the medical workers, the doctors, the nurses, the ward boys which are working in the ICU. If they are also able to interpret what the data is telling them, they can also engage with the doctor at the right time, alarm him about the deteriorating cases of the patient, and then help the doctor in taking a call at the right moment. We can move forward again. This is what a command center looks like. I will be this might be exaggerating to some people because it's not currently being followed in India right now. There are some centers who are running a Tele-ICU setup, and this is exactly what a Tele-ICU setup looks like. So this command center is not the place where the patients are physically present. This command center can be anywhere in India or abroad. The bottom line monitors that you see, the left from left 1, 2, 3, these represent the patient. So there are about 6 patients per monitor in the current picture. So which makes that single doctor looking at data of around 18 patients. So a single doctor is monitoring vitals of 18 different patients, and he is able to take call. He is able to analyze the data, and if he wants further data of that particular patient, he can use multiple screens to see either the ultrasound reports of the patient, either the pathological reports of the patient, either the trend, past 24 hours trend of how the patient is doing. And if he wishes to see the patient, he can also do that through a webcam system, so that he can physically assess the patient, and instruct the staff present in the ICU to in order to take that right call to the patient. Then we come to some of the technologies, some of the equipments that are being used to transmit these kinds of data, so that a clinician can take a right call at the right time. First one is the patient monitor, which the hind-end monitoring system, which comprises of measuring of blood pressure, both internal, both invasive and non-invasive, SpO2 saturation, cardiac parameters, neuroparameters, and scoring and sepsis protocol. So there are many invasive parameters and non-invasive parameters which can now be seamlessly the data from those parameters can now be seamlessly transferred from one place to another by the help of either a wired network or a wireless network, or through currently we are going towards 5G, 4G and 5G setup wireless SIM networks. These can also be inserted into the equipments, and so that the equipment starts throwing out data from the equipment, and anyone at any place from a remote location or from a city other than the current city can access those information for the patient and take a call on the treatment line which is going on the patient. The second are the ventilator systems. So the high-end ventilators for the future currently transmits all the ventilation parameters, PF and V waveforms, loops, spirometry, graphic lung displays, and lung pneumatic details all at once to the end user or to the clinician which is taking care of the patient remotely. Continuing with that, we also have currently smart infusion systems which are being wired with networks so that the medicine delivery is tracked remotely. How much of the drugs or the medicines have been given to the patient, which one to tweak, which one, the rates of the drug delivery can be increased or decreased remotely also through the automated and automation. And there are the high-end infusion system comprised of fluids, medications, nutrient delivery, long duration infusion, or automated and equipped with, they're also equipped with safety features to prevent any harm to the patient. This shows the basic layout of an ICU where every equipment is connected, the patient is in between, then the patient is connected through a multi-para monitor. It is connected to a infusion system, is connected to a ventilator. All these data is being moving from that patient to the central monitoring system, and from that central monitoring system, it can be accessed from anywhere on a remote platform by a doctor on his laptop or on a portable mobile device. If the doctor wants to see the condition of the patient, he can also access them through a webcam, which is placed inside the ICU and the patient. The same in that same there may be more than one patient in an ICU. So for all those patients, and if there is a single doctor working on a remote location for all those 10 to 12 to 14 patients, there has to be integration of data in a seamless manner so that the patient, a clinical decision on the patient does not result in a clinical error. Thus, it will improve work efficiency. It will be synchronized with patient information system so that the right patient gets the right treatment. The treatment from the doctor is not being given to some other patient. Then all the bedside device data is being captured automatically to a third-party setup wherein the data remains stable, the data is not lost, and anyone can access the data afterwards, so that in order to review the condition of the patient. The current, we've been talking about Tele-ICU quite some time now. So in a Tele-ICU setup, with the actual treating doctor need not be physically present in the same ICU. He can sit anywhere across the world and can access the patient through a team of junior doctors, nurses, and paramedics. So a specialist need not be physically available with the patient. Still, though, the specialist can take calls on the patient, and he can be available 24/7 remotely accessing through a command center, which we already saw. So these technologies are currently reshaping how these hospitals are becoming more and more smart. There are hospitals which are currently using that system, and there are hospitals which are not using that system, but still they are using some kind of data traveling and data seeming data functioning systems to make their hospital smart. And it is not ending here. It will keep on evolving, and the hospitals will keep on making themselves more and more smarter through the coming time. So that is all from my end, and thank you everyone for listening to me so patiently, and thank you very much. That's all from my end now. Thank you.